Back now on Try It Today. I'm fascinated about meeting this next guest. He has a very interesting title and does very important work. Let's take a look right now. Our special guest is Dr. Kurt Daniel. He's an interventional cardiologist with Carolina Cardiology Cornerstone. Welcome, Doc. How you doing?
Thanks, Jim. Glad to be here.
I guess my first obvious question is, what is an interventional cardiologist? We've all heard about cardiology, know it has something to do with the heart, and what is this?
Sure. An interventional cardiologist is a cardiologist who has additional training in using special procedures to help people with problems of the heart and of the blood vessels. We do procedures like heart catheterization, angioplasty, and stenting using minimally invasive procedures through small tubes that go in the arteries or the veins of the periphery.
Right. And I understand that a lot of these procedures, and you may have already named some of them, but are done in much different way than they used to be traditionally. Can you sort of give us a little history lesson and tell us where we were and where we are now?
Sure. In the past, heart catheterization in particular has been done by using large tubes in the arteries of the leg, the groin, and sometimes of the elbow there. Over the past decade or so, the size of the devices has gotten smaller and smaller, which is great because it reduces the incidence of complications. More recently, we have developed techniques to go through the artery in the wrist called the radial artery, which is much smaller and much less prone to bleeding. By using very small devices, we can do most interventional cardiology procedures through that very small radial artery with much more patient comfort and much less risk of bleeding complications.
And you can, I'm assuming all this is done outpatient.
Diagnostic procedures are done on the same day, and the patient can go home in a few hours. They can walk immediately after the procedure and have lunch, and then if there are no complications, go home in a few hours in most cases. If a stent or other kind of interventional procedure is necessary, then most patients need to come into the hospital just for overnight.
We didn't rehearse this, but I want to do a follow-up question on something with you very quickly, and that is, how would you know that you needed to be referred to someone like you for some of these procedures? I know you probably go to your general practitioner, but I mean, what would be going on in your life that would cause you to need something?
Well, the kinds of procedures that interventional cardiologists do include procedures for chest pain or angina, procedures for heart valve problems, and procedures for congenital defects of the heart.
So I could be having chest pains, go to my regular doctor as long as I wasn't in real distress, and he might say, look, we need to check this out, and then that's when I end up where you are.
That's right.
Any other techniques or procedures or things that are on the horizon that might be available in the future that have you sort of excited or looking forward to using?
Yeah. There are some procedures that we're doing now that I think are very exciting, and some ones that we're developing for the future. Procedures that we're doing now include procedures to close defects in the heart that people are born with, defects called patent foramen ovale and atrial septal defect.
Right, I've heard of that.
In the past, patients have needed to have open heart surgery to repair these, but over the past decade or so, we've developed techniques to do that through little tubes and with little devices. In addition, there are people who have some kinds of heart valve disease that can be very debilitating, and in certain select circumstances, there are patients who can be treated for those problems with balloons through small tubes in the arteries as well.
You know, since I'm going to give some information on a Cornerstone website in just a second, but before I do that, since this is your first time here, I wanted to find out a little bit about you. Where were you born?
I was born in suburban Denver, Colorado,
okay,
in a little suburb called Lakewood.
All right, got you. Now, was your father or mother, were they doctors or in medicine or have any connection?
No, my father is actually a chemistry professor. He's recently retired. And so there was a lot of science in our house, and we talked about the latest developments in science and medicine over the dinner table. And that frequently prompted a lot of discussion. For a long time, I was the least educated of all of my siblings.
Yeah.
And I eventually caught up with the rest of them, but most of us went into some branch of education or science.
See, in my household, the conversation was about, Dad would say, why were you sent to detention today? That was pretty much it. No, I mean, but seriously, before we run out of time, why did you want to become a cardiologist?
Well, there are two parts to that. One is, why did I want to become a physician? And one is, why, after I became a physician, why did I want to become a cardiologist? I became a physician in large part due to profound experiences that I had with health and illness involving my family and friends. One of my best friends in college died suddenly, and a number of my family members and very close friends and relations had serious health problems. And I was inspired by the health care provided to them by their physicians. And that's what led me to become a physician.
I just think that's great. They're wrapping us up. I want to get you back sometime, but here's a website for you to look at, www.cornerstonehealth.com. Take a look at that. And we are so honored to have had Dr. Kurt Daniel. And will you come back?
I'd be glad to, Jim. Thank you.
Thanks, Doc.
All right.